Hello, nursing scholars. To recapitulate the teaching content in the flipped classroom that is delivered through a web page titled Improve Case-Based Approach in Managing Multimorbidity, let me give an overview of what you were expected to learn at the end of the lesson. Since critical thinking has a vital role in clinical decision making because it enables healthcare professionals to analyze complex situations, make well-informed decisions based on evidence-based practices, and prioritize patient needs that ultimately improve patient outcomes. In holistic nursing practice, critical thinking aids nurses to address not only the physical aspect of a person or a patient, but also the emotional, social, and psychological factors that affect individuals, especially in managing multimorbidity, where personalized integrated care plans are essential. The impact of social determinants of health, or SDOH, such as socioeconomic factors, is also crucial in the management of the complexities of multimorbidity, which influence health outcomes and prompts tailored interventions. During patient assessments, critical thinking allows nurses to assess the links between multimorbidity and social determinants of health, which help to develop a comprehensive care plan. Additionally, critical thinking enhances communication and teamwork within multidisciplinary and interdisciplinary teams, which ensures that diverse perspectives from the interprofessional care teams are integrated and patient care is effectively coordinated to improve health outcomes. To summarize the key points and structure, let me highlight the important details that students should have understood from the lesson content that was presented through the web page. In Chapter 1, Critical Thinking in Clinical Decision Making, critical thinking is important in the clinical decision making and ensures evidence-based, person-centered care that promotes patient safety. Healthcare providers make informed decisions that are geared toward optimal patient outcomes by combining evidence-based research, clinical experience, and patient preferences. It also helps identify risks, reduce biases, and improve problem solving. It fosters collaboration and reflection for continuous improvement. Holistic patient assessment and patient advocacy are essential to developing critical thinking in clinical decision making. Considering the patient's physical, emotional, and social health, improving problem solving and prioritizing care is a holistic approach, while advocacy ensures that decisions are ethically sound and are focused on the patient's well-being. It enhances communication and decision-making skills and is crucial for managing multimorbidity in adult populations to integrate clinical decision-making with interprofessional collaboration and holistic care. Nurses must use critical thinking to coordinate care and collaborate with other professionals, which lead to better patient outcomes. Both medical and psychosocial factors are addressed holistic care practices, while collaboration promotes cultural sensitivity and reduces healthcare fragmentation. In managing multimorbidity, clinical decision-making and interprofessional collaboration are indispensable due to the complexity of multiple chronic conditions. Multimorbidity requires coordinated, patient-centered care because it reduces quality of life and may cause mental health challenges. Healthcare professionals can improve good patient outcomes, reduce cost, and enhance well-being by addressing social determinants of health and by providing integrated person-centered care. In Chapter 2, Understanding Multimorbidity, multimorbidity is the presence of multiple chronic disease conditions that present significant challenges in nursing practice. Multimorbidity is distinct from comorbidity because multimorbidity is the coexistence of two or more chronic conditions in an individual, regardless of whether the diseases are related to each other. Comorbidity, on the other hand, refers to the presence of one or more additional pathological conditions that are typically linked to or interacting with a primary disease condition. Although multimorbidity and comorbidity both involve the presence of multiple health problems, they differ in meanings. In short, multimorbidity involves unrelated chronic health conditions, while comorbidity relates to secondary conditions that are influenced by a primary disease. Nurses play a key in identifying these complexities and creating a plan of care in managing the condition by addressing not only clinical needs but also the social determinants of health, or SDOH. A holistic person-centered approach is essential for the planning and delivery of comprehensive care to individuals with multimorbidity. The impact of multimorbidity in adults is an important issue because it affects both physical and mental health. People with multiple chronic conditions experience greater risk of disability, mental health problems like depression and anxiety, and reduced quality of life. This complex condition leads to increased healthcare utilization, frequent hospitalization, and higher healthcare costs. It also leads to social isolation and decreased life satisfaction. Multimorbidity is a global burden that strains healthcare systems, particularly in regions with higher statistics of aging populations. Chronic conditions such as cardiovascular diseases, diabetes, hypertension, and chronic kidney disease are on the rise, which is driven by modifiable risk factors and unhealthy lifestyle behaviors amid increased healthcare costs, fragmented care, and resource limitations that worsen health outcomes. Risk factors for multimorbidity include lifestyle choices and socioeconomic status, which all contribute to the development of multimorbidity. Older adults are more susceptible, while unhealthy behaviors like poor diet, physical inactivity, smoking, and substance abuse may exacerbate the risk. Additionally, lower socioeconomic status predisposes an individual to limited healthcare access, malnutrition, and may lead to inadequate living conditions, which make social determinants of health crucial in managing multimorbidity. In addressing multimorbidity, a multifaceted approach that is focused on prevention, early detection, and managing social determinants of health is required. In these situations, nurses play a vital role in identifying risks, promoting healthy lifestyle, advocating for lifestyle changes, promoting health-related behaviors, and collaborating with interprofessional team members to offer comprehensive care. In this manner, nurses also contribute to achieving the Sustainable Development Goals or SDGs through, through collaborative efforts to improve access to care, reduce health disparities, and support vulnerable populations. Nurses can significantly improve health outcomes for individuals with multimorbidity by addressing the social determinants of health and practicing holistic care. Chapter 3, Chronic Conditions in Multimorbidity. Multimorbidity presents a significant health care challenge that demands comprehensive management. Common chronic conditions include hypertension, diabetes, obesity, cardiovascular diseases, chronic obstructive pulmonary disease, cancer, anxiety disorders, depression, and substance abuse disorders that often coexist and complicate treatment. Coordinated care is crucial and needed to manage these conditions and prevent exacerbation of symptoms and reduce hospital readmission. Additionally, managing multiple chronic conditions is challenging due to factors like polypharmacy, which may increase the risk of drug-to-drug interactions and side effects. Nurses need to educate patients on proper medication use and must coordinate care across specialties to avoid therapeutic regimen conflicts. Furthermore, in the management of completing treatment goals, careful monitoring is required to ensure the best possible health outcomes for the deceased individuals or patients. Patients' adherence to the treatment goals and self-management also pose significant challenges, as managing multiple conditions can overwhelm most patients. Nurses need to provide ongoing health education and therapeutic support to help patients manage and maintain their health and identify other psychological factors like depression and anxiety. Addressing these psychosocial factors will improve overall patients' well-being and improve holistic care. To overcome these challenges, nurses must use strategies like comprehensive holistic assessments by taking into consideration the physical, psychosocial, sociocultural, economic, and environmental factors. Personalized care plans are developed based on patients' preferences and health goals, where nurses play a vital role in education and self-management support. Care coordination between healthcare providers and the use of technology like electronic health records and telehealth may help streamline care and ensure holistic treatment. A person-centered approach is crucial for the effective management of multimorbidity. Additionally, nurse advocacy, will address social determinants of health and will ensure that patients have access to necessary resources. Collaboration with other healthcare professionals addresses all aspects of a patient's health, which leads to improved patient outcomes. Ultimately, a comprehensive and holistic approach is needed in managing multimorbidity because it ensures care coordination, provides health education, and supports self management for overall health outcomes. In Chapter 4, Management of Multimorbidity, social determinants of health, or SDOH, significantly influence the development and progression of multimorbidity and create an interdependent relationship. Low socioeconomic status, poor access to education, limited healthcare access, and inadequate housing conditions contribute to economic conditions which may exacerbate multimorbidity. Similarly, the presence of multiple chronic conditions can worsen an individual's social circumstances, which create a cyclic pattern that leads to poor health outcomes and increased demands on healthcare systems. In providing holistic care, comprehensive nursing assessments are essential by assessing not only physical health but also emotional, social, and psychological factors. Tailored, person centered interventions that promote patient engagement and trust to improve health outcomes can be created by considering social determinants of health. Critical thinking is key in analyzing the complex situations in multimorbidity, in prioritizing patient health needs, and in advocating for resources and support that will ensure patients receive effective care. Additionally, nurses have a critical role in addressing social determinants of health and achieving health-related sustainable development goals, or SDGs, by addressing social determinants of health such as advocating for health equity and reducing multimorbidity. Nurses may advocate for policies that target the root causes of health disparities, including access to healthcare, education, and housing. Nurses may also work in the community for health promotion and disease prevention, educate patients, and collaborate with healthcare providers to include both medical and social factors in care management plans. In addressing both medical and social factors, improving health outcomes, and reducing the burden of multimorbidity, nurses promote equitable access to care. Advocacy, education, and collaborative efforts with other healthcare professionals will help achieve SDGs, health and poverty reduction. As a result, nurses will contribute to a more inclusive healthcare system, promote health and prevent chronic diseases, and will improve the quality of life for individuals with multimorbidity. In identifying social factors during patient assessments, the nurse may use various methods, such as structured tools like improved social determinants of health screening tools. Assessment of mental health and stress level will also identify social risk factors that influence health outcomes. They can ask open-ended questions in the hospitals or facility-based care settings, or observe the patient's environment in home health setting and community health setting to uncover challenges related to medications, transportation, nutrition, housing and living conditions. Collaboration with interprofessional healthcare providers and community health workers is crucial in addressing the broader impacts of social determinants of health. Nurses may work in interdisciplinary care teams to create comprehensive and integrated care plans that address both medical and social needs and may also refer patients to social services when necessary. This collaborative approach will help ensure that patients receive the resources and support that they need to improve their health outcomes. Nurses may serve as an advocate for policy changes and may partner with local organizations and community organizations to address the root causes of social determinants of health, to address immediate patient needs and ensure coordinated care for patients. Nurses contribute to a holistic, patient-centered approach to healthcare that improve health outcomes and supports vulnerable populations by collaborating with other professions and organizations. The 17 Sustainable Development Goals were adopted in 2015 by United Nations member states as part of the 2030 Agenda for Sustainable Development to address global challenges and create a more equitable and sustainable world. SDG 3 is focused on good health and well-being, which is central to improving health outcomes in a global context by ensuring universal healthcare coverage and improving mental health, among others. The broader SDGs also indirectly impact health outcomes because they address social and environmental factors such as clean water, nutrition, education, and economic opportunities. Social conditions such as poverty and poor living conditions significantly influence health outcomes. SDG 1, no poverty, SDG 4, quality education, and SDG 5, gender equality, and SDG 10, reduce inequalities, address social determinants of health by seeking to eliminate poverty, improve education, ensure gender equality, and reduce income disparities. The SDGs provide a holistic approach to health by linking it to other aspects like education, living conditions, employment, and gender equality. Nurses have a key role in achieving health-related SDGs by addressing social determinants of health through health advocacy, health education, and patient-centered care by identifying and addressing barriers to health management and health maintenance while ensuring that patients receive both medical and social support, and by engaging in community outreach and policy advocacy which contribute to broader efforts to improve health outcomes and achieve health-related SDGs, which will ultimately help reduce multimorbidity by addressing social conditions like poverty, education, and inequalities which exacerbate chronic health conditions. The essential concepts that students should understand after completing the pre-class materials are critical thinking, clinical decision-making, multimorbidity, chronic diseases, holistic nursing, interprofessional collaborative practice, social determinants of health or SDOH, sustainable development goals or SDGs. In conclusion, the main goals of this session are to deepen students' understanding of critical thinking in clinical decision making in the context of managing multimorbidity. In the lesson, we explored how critical thinking skills are essential for conducting holistic patient assessments, in addressing social determinants of health, and in working collaboratively with interprofessional teams to improve patient health outcomes. The flipped classroom format with a web page and suggested learning resources are the components that are designed to foster deep learning by encouraging students to engage with the content independently before coming together as a group to discuss and apply their knowledge in a reverse clinical case study as an evaluation tool to assess the learning at the end of the lesson. By using this format, students are given the opportunity to reflect on complex real-world scenarios, develop critical thinking skills, and actively participate in collaborative learning with their peers by using the custom format of interprofessional collaborative reverse clinical case study, which enhances both their understanding of complex nursing scenarios and their ability to address them effectively in nursing practice to bridge the gap between nursing education and practice. This approach aligns with the students' learning objectives and promotes a more interactive and student-centered learning experience that prepares them for the complex and diverse real-world healthcare settings. The students will apply the knowledge from the flipped classroom learning content to real-life context through a group work problem-solving task in the clinical and social problem-based scenarios that are presented in the web page as a formative learning process, and a group task reverse clinical case study that is distributed through Google Classroom. A custom format guide of the reverse clinical case study is also introduced at the lowermost portion of the web page. The reverse clinical case study assignment, instructions, and rubrics are also provided in each clinical case scenario.